In 2018, the United Kingdom took a significant step forward in healthcare by legalizing medical cannabis. This landmark decision brought hope to countless patients suffering from debilitating conditions. For the first time, specialist doctors in the UK were authorised to prescribe cannabis-based products for medicinal purposes. This move followed a growing body of evidence highlighting the therapeutic potential of cannabis for various medical conditions. The new regulations aimed to provide patients with safe and legal access to this alternative treatment option. The legalization of medical cannabis was welcomed by patients, advocates, and many healthcare professionals. It marked a shift in perspective, recognizing cannabis as a potentially valuable tool in modern medicine. However, the journey to accessible and affordable medical cannabis in the UK has been fraught with challenges and limitations. The 2018 regulations, while groundbreaking, established a strict framework for prescribing medical cannabis. Access would be limited to patients with specific qualifying conditions, and prescriptions would only be issued by specialist doctors on the General Medical Council (GMC) specialist register. This decision aimed to ensure that medical cannabis was prescribed responsibly and only when deemed clinically appropriate. The legalization of medical cannabis in the UK ushered in a new era of healthcare, offering a glimmer of hope for patients seeking alternative treatment options. However, the road to widespread access and affordability remained long and winding. The following sections will delve deeper into the intricacies of medical cannabis in the UK, exploring who can prescribe it, the conditions it can treat, the available products, and the challenges patients continue to face. The legalization of medical cannabis in the UK came with a crucial caveat. Only specialist doctors could prescribe these products. This restriction was put in place to ensure that medical cannabis was prescribed responsibly and only after careful consideration of a patient's medical history and current condition. Specialist doctors, as defined by the regulations, are those registered with the General Medical Council (GMC) and listed on the specialist register. This means they have completed advanced training and possess expert knowledge in a specific medical field. Examples include neurologists, pain specialists, and psychiatrists, depending on the nature of the patient's condition. The decision to limit prescribing power to specialists sparked debate. On one hand, it ensured that patients received care from doctors with the necessary expertise to evaluate their suitability for medical cannabis and manage any potential side effects. On the other hand, it created a bottleneck in the system, as the number of specialists willing and able to prescribe cannabis remained limited. This bottleneck has contributed to long wait times for patients seeking consultations and prescriptions. Many patients, desperate for relief from their conditions, face frustrating delays in accessing this potentially life-changing treatment. The limited number of prescribing doctors also raises concerns about geographical disparities in access, with patients in certain areas facing greater challenges in finding specialists.